So when a psychiatrist or therapist sees a clinical depression, there's a few characteristics that come up with it. One is, what is the mood most of the time over the past few weeks? And clinical depression is going to be sad, tearful, maybe hopeless or helpless. And another question to screen for is there still an enjoyment in daily life? If either of these are affected, if there's a sad mood most of the time, or life is not enjoyable, or there's no interest in doing activities that one typically enjoys, then it could look like one is going through a clinical depression. What makes it a clinical depression versus just sad mood that comes and goes is, does it happen most of the time for 2 weeks? And is life being impacted in a negative way? And most commonly it can be in work or school or in one's relationship. Depression can affect people in different ways, but other ways it can affect people and it can change their sleep, either cause people to sleep more than normal or less than normal. Appetite, they can lose weight or even gain weight from changes in their appetite. Their energy may be affected, their motor activity, and again, this can go either way. Sometimes the concentration can get affected. Maybe they feel like worthless or have guilt or don't have hope for the future. In really severe cases, it can get to thoughts of suicide, and I just talked about that in a recent video, so you could click the link on above if you'd like to learn more about what to do in those cases. We don't know 100% certainty what causes clinical depression. There's some different theories. Some theories is that a little bit amount of stress is a good thing, but if there's too much stress or too little stress, then the homeostasis of the body, or that balance, gets out of whack, and that can lead to like anxiety and depression. Sometimes there can be a family history to it. So example, if one's parents or siblings or cousins or somewhere along the lineage in the family, someone has a mood disorder such as bipolar or depression, that can suggest maybe more likely that other people will have it as well. Perhaps it could be caused by any foreign substance use, like illicit drugs. Maybe it's alcohol, maybe it's cannabis. Those things can cause biochemical changes suggestive of depression. Maybe it's more general of poor self-care. For example, people who are obese tend to have higher psychological symptoms such as anxiety or depression. Maybe it is something stressful in one's life, such as loss of a job, a family member getting sick, maybe going through a divorce or financial problems. Maybe there's something happening with a medical condition that's causing it. Maybe the thyroid is low. That can be associated with depression symptoms. Maybe there's a recent illness someone is recovering from. Perhaps it's even side effects of medications, pain medications such as opioids. Long-term use of that can be associated with depression or mood. So you can see there's really a lot of different components to what could cause depression, if anything. Perhaps it's just one is prone to get sick, and depression is a sickness. Various treatments, certainly depending on the cause, you want to address any underlying causes, but the treatments also tend to be medications or therapy, like psychotherapy. Many different medication types. I talked about SSRIs in a previous video. There's also another type of medication class called SNRIs, most commonly in the United States. Duloxetine and venlafaxine can also be associated with antidepressant effects. There's also Pristiq, which is in this class, that can be associated with antidepressant effects. Propion is a good medication for seasonal depression. It can also help with symptoms of attention deficit or ADHD, and it doesn't work exactly like the SSRIs or SNRIs. It works a little bit differently, so that can be a good one as well to try. If someone is not sleeping and has poor appetite or losing weight, another option is mirtazapine. That can help one to sleep at night and increase their appetite, so that may be a good option. So just like in certain medical conditions like high blood pressure or diabetes, maybe it can be treated with lifestyle changes. Maybe it needs 1 or 2 medications to have an effect. For some people, depression can be the same way. Maybe it's just lifestyle changes if it's not that severe. Maybe it's just mild. that can make some fine-tuning in their life. But in the more severe types or stuff that's harder to treat, maybe it takes 1 or 2 medications to help it to go away. Other ways to treat it are electroconvulsive therapy or transcranial magnetic stimulation. Transcranial magnetic stimulation is something that I do offer here at my office setting, and a lot of private practice clinics do have it. Electroconvulsive therapy needs more help with anesthesiologists because you put the person on basically to sleep, and you have to paralyze the muscles because you're causing a seizure. It's also shown in by Jack Nicklaus in One Flew Over the Cuckoo's Nest. For therapy, there's different types of therapy, and it really depends on what's going on. If it's a relationship problem, then maybe focus on interpersonal therapy. If someone lost a loved one or someone significant in their life, maybe grief therapy. If it's just sort of fixing any distorted thoughts like negative self-talk, things like that, then cognitive therapy may be the way to go. There's some important behavioral or lifestyle changes one should incorporate in trying to deal with depression. One of the most important ones is there used to be a Nike slogan called "Just Do It," and they have that Nike swoosh. Well, that's sort of what it takes to help with depression sometimes. If you're not feeling like doing an activity that you enjoy, that's healthy, if you're just prefer to stay at home or lay in bed or not feeling like getting up and doing something, you gotta force yourself to do it, just do it, and that will help to get out of the depression and help to feel better. If you can tolerate it, and as run by your primary care doctors, try to exercise regularly. Both aerobic and anaerobic exercise can help with mild and moderate symptoms of depression and anxiety. Again, eating healthy, vegetables, fruits, healthy sets of proteins, etc. That can also help with psychological symptoms and bring down symptoms of anxiety and depression. Practicing gratitude, keeping a journal or just making a check mark of things you're thankful and grateful for is important as well. Also, a community support can be important, whether it's friends or family or religious services. I find that attending religious services helps with symptoms of depression, making them less severe and not as intense. So it's not, it's a little bit different than just worshiping at home. So if there's any negative thought or feeling that causes you to feel sad or depressed, don't dwell on it or ruminate on it, because that will just make it sort of grow bigger. Try to distract yourself from it, ignore it, push it aside, let it go one ear out the other. Don't pay much attention to any negative thought or feeling. You know, in the book of Proverbs, the King Solomon says it best, and that anxiety in the heart of man causes depression. So there's many ways to treat depression. It's not a one-size-fits-all. It's different for different people. Hope you like this video. Be sure to like the video, subscribe to the channel for more videos.